Breast augmentations continue to be one of the most popular plastic surgery procedures in the country. While its popularity remains high, the health risks associated with it have one Michigan plastic surgeon vowing to never perform the procedure again. Dr. Shaher Khan completed one breast augmentation to become board certified and now only exclusively does explants, taking them out. He says some people jump into the procedure without understanding the full risks and has a warning this morning.
Plastic surgery has become commonplace. From rhinoplasties to tummy tucks, it's not a far-fetched thing that only celebrities have access to anymore. In fact, in 2021, around 381,000 liposuctions were performed in the U.S. and 378,000 breast augmentations. And everyone has their reasons. Jacqueline Kiminita from Macomb County wanted a breast augmentation after being bullied for years about her looks.
I would get made fun of, and people would say just like little comments, and you try to brush them off, but after you hear them like over and over for a while, it kind of gets to you and you feel like something's wrong with you.
In 2016, she saved up her money and decided to go ahead with the procedure, but her excitement quickly turned to panic.
I had low libido, night sweats, brain fog, joint issues, weight gain. I actually had a hard time, got to a point where I couldn't swallow my food because my lymph nodes were swollen.
Jacqueline had a multitude of symptoms, including getting this black eye out of nowhere. She later realized she had breast implant illness, had 2 corrective surgeries, and finally she went ahead with a 4th procedure, the full removal of her implants, putting her out about $30,000 in total.
If you talk to the ladies, they will tell you they certainly are not well aware of the many risks that are associated with breast implants.
Board-certified plastic surgeon Dr. Shaher Khan is now dedicating his life to warning people of the risks associated with breast implants, including breast implant illness, or BII.
5 years ago, not many people had heard of breast implant illness. Nowadays, everyone is talking about it.
The FDA defines BII as a term coined by clinicians and patients to describe symptoms reported by women after breast reconstruction or augmentation. Symptoms like fatigue, brain fog, joint and muscle pain, and more. It's a broad descriptor of symptoms after breast augmentation, not an official medical diagnosis, but 71,000 people had their implants removed in 2021. It's not tracked how many of those removals were associated with BII.
There is a direct link and association, as highlighted by the FDA as well, and also by the manufacturers, that breast implant illness does indeed exist.
And just this month, the FDA linked the procedure to squamous cell carcinoma, a type of skin cancer. Last September, the FDA released a warning about breast implants and a connection to other various lymphomas, including a form of non-Hodgkin's.
They are a direct result of the implant. Had the implant not been there, these ladies would not have gotten the lymphoma or the squamous cell cancer, and this is way underreported.
After Jacqueline got her implants removed, she said all her symptoms disappeared. Now she only wishes she would have done more research before going under the knife.
With social media, young girls, you can look at anything all times of the day and compare yourself to somebody else. But it's, what is it worth?
And Dr. Khan continues to push his message for women to be aware of the risks and dangers and to stay up to date on all the warnings.
Yeah, we do have more information on our website. He has a full website where he's dedicated his life's work to just informing women. Yeah. And there is a Facebook group in Michigan for women experiencing BII. And there's thousands of women in there, and they helped me get this story up. So I want to say a big thank you to them, and hopefully they can learn something
I'd never, ever have heard of. Yeah. Crazy. All right, thanks a lot, Ruta.